Welcome to Doc Talk, a weekly podcast featuring Monument Health physicians addressing medical topics. Tune into your health with Monument Health. Hello, everybody, and welcome to another edition of Doc Talk with Monument Health. I am Mark Houston, and back with me again is Dr. John Tronnes, family medicine physician up at Monument Health in the Lee Deadwood Clinic. Welcome back, Dr. Tronnes. Yeah, you bet, man. These conversations I've had with you have been so enlightening. A lot of these even off the podcast a little bit here that I want to bring in. Today, we want to talk about adult vaccinations specifically.
Yep.
Hopefully, if you have children and you run them through the regimen to make sure that they grow up to be healthy, normal adults with their vaccines. But there are still, as we get older, obviously, vaccines that I think we need to take. Mm-hmm. In your opinion, has there ever been a bigger advancement in medicine than vaccinations?
No. And that's a pretty commonly thought thing, is that vaccinations against diseases was probably one of the biggest advancements in medicines, right up there with antibiotics.
It really is amazing that the smart people, the doctors like yourselves, were able to sit down and come together and realize what these things can do for people, mm-hmm. right? So if you are not sure where to begin with adult vaccinations, let's start there, okay? How can you check your vaccination status? Let's say you grew up and maybe your parents didn't keep the best records, or you didn't really follow up, and now you're like, I got to get kind of serious about this. Where's the place to start?
That is a tough one. So for a lot of people, and I've actually done this myself, you can contact whatever school system you are at, and they'll often keep decent back records of students, and so you can oftentimes get your records from there. States will have their own, records of your vaccinations, and so you can contact your state Department of Health for some of those records. But yeah, there's some that end up falling through the cracks of people like, I could have swore I got this vaccine at said and said pharmacy in this state and this time. And
are there vaccines you get as a child that you don't ever have to have again?
Yeah.
Or really? Mm-hmm. Like which ones?
So let's see.
I mean to put you on the spot here, but that just popped into my head. So,
polio vaccines.
Oh, there we go. Yeah.
Those ones tend to be just in childhood. Largely measles, mumps, rubella vaccine, that MMR vaccine. Mm-hmm. That one's done in childhood. They've come out with recent recommendations that maybe if you're having like a high incidence in your region, because sadly there are cities now where we're having measles outbreaks and things like that.
Right.
It might not be a bad idea for an adult to get a booster, like a one-time shot. But largely, no, you never have to get an MMR, measles, mumps, rubella vaccine again. Okay. So yeah, there are a few.
So obviously, the one we've been living through the last 3.5 years or so mm-hmm. is COVID. Mm-hmm. And we were talking about vaccines that had come out before treatments, mm-hmm. correct? And mm-hmm. COVID is a pretty good example of that.
Yep.
Because now there are treatments for COVID.
Yep.
But you still would recommend a vaccine.
For sure. The treatments are far from foolproof, mm-hmm. and oftentimes if you put it in light of someone who's already been vaccinated, end up working a lot better. But overall, vaccines for COVID, they help reduce, amount of people that end up in the hospital, ended up in the ER, which is important as far as other people trying to get access to healthcare facilities. During the pandemic, kind of in the midst of it, hospitals were constantly full. Mm-hmm. I was working in Minnesota during it, and it was constantly, nope, we can't take that person. You're going to have to take care of them there in this small hospital where, we've never taken care of this in our life in this hospital, but we get to now because they're full of people with COVID. And so now with vaccinations, and a good portion of the population is vaccinated against COVID now, people just aren't getting nearly as sick as they used to when they get it. It still happens where you still see people in the hospital with COVID, but it's few and far between nowadays.
It's gotten better, mm-hmm. obviously.
Mm-hmm.
So let's move on to flu. And this mm-hmm. seems to be the one where a lot of people, I talk to so many, and it's kind of frustrating, but I kind of get their argument in a way. They say, I don't usually get a flu shot because they're always guessing at the strain. Mm-hmm. Is that correct?
Yes.
Okay.
I mean, it's more than just guessing.
Right. Right.
There's
of
a lot of data and things that go into
yes.
it. But yeah, it's far from foolproof. And yeah, there are years where they say it's only 35% accurate. But before I go into flu, I do want to give an update on COVID vaccination.
Oh, please.
Yeah. I don't know, anybody out there who's vaccinated. In the early days, it was a 2 or 3 part vaccine, and then you got your booster recently. Nowadays, one shot. They have the bivalent vaccine. They're recommending people just, if you've never been vaccinated, nowadays it's just one shot. So if that was a barrier for people, you can go out there, get one shot, and be completely vaccinated from COVID now. And if you've had the booster and you're immunocompromised or older than 65, they are recommending an additional booster 4 months or more after your first bivalent booster. And so the hope is that in the future it's just going to be like a once-a-year shot,
like a flu
shot.
Yeah, excellent. And I know that, I think it was back in October, November, I went in, made an appointment, got the flu and the COVID shot. I was out in 3 minutes, and I haven't gotten either. So it's great. All right, so back to the flu. Are there generally always just 3 versions? Is that right? Or where did I could be way off on that.
So with influenza, you have kind of 2 bigger umbrellas, so influenza A and influenza B. And most influenza vaccines nowadays will cover 4 different strains. And so they'll be, this is the common strain of influenza A that we think is going to be around. This is the common strain of influenza B that we think is going to be around based off of what happened in Asia, what happened in Australia, things that are going to be coming across the ocean and coming to us eventually this season. And then also kind of the more severe strains, so that old H1N1 influenza that came and caused so much issues, pretty much all vaccines are going to cover that nowadays because it was so severe. And so, it'll cover, A, B, and like the common strains we think are going to be here, and then the more dangerous strains that have happened in the past. And for most of it, it's just one vaccine. You get it in the fall. Influenza tends to hit in the winter and not really an issue in the spring and summer.
Yeah.
For older adults, they do recommend high dose. So 65 plus, you get like a double dose of that influenza vaccine. Otherwise, it's just that single dose. And for people who are kind of anti-shots, they, in certain places you can find the intranasal vaccine even. So just a spray that goes into your nose that seems to be effective.
What do you... I don't mean this to be too loaded. What do you recommend to people that are vaccine hesitant? I mean, what's your, as a doctor, what's your go-to?
I tend to try to find out what's important for them, or why are they afraid of said vaccine. So, if we can kind of tie this to, hey, you have small children, and maybe as a 20-something-year-old, you're not going to have much issues with influenza, but a 1-year-old definitely can have issues with influenza. And so you getting vaccinated can help them not get it. Or maybe you have an elder, a grandma, grandpa, great something that you spend a lot of time with or helping care for. Again, these vaccines are far from foolproof. And in those situations, the more people we can get vaccinated, the better it is, essentially. And so if you can get vaccinated and hopefully not pass it on to a grandparent. And so sometimes we'll talk about that. And then also times there ends up being a lot of, old wives' tales about, this vaccine causes influenza.
Right.
And I'll try to do my best to kind of, use logic. But people, they respond to a more emotion more than logic.
Sure.
And so, when I tell them, well, actually, influenza vaccine is chopped up little portions of the virus that can't actually infect you. It's just these little antibodies and things like that your body's going to be making. People don't necessarily hear that all the time.
Sure.
But when they hear, you can help protect your 1-year-old grandkid or, your grandparent, people will respond to that.
Oh, that's a good approach to take. Sure. Okay. Another one that I've heard about quite a bit, but I would like you to explain really what this is, and that is hepatitis. Yeah. B specifically, right? How many different types are there? Oh, there's a lot? Oh, my God.
So hepatitis A, B, C, D, and E.
Oh, wow. Yeah. Okay.
And hepatitis B is one that's commonly vaccinated for starting in childhood nowadays. When I was a kid, I think you had to have it all done by like 13, but nowadays people will have it all done by age 1.
Yeah, I remember with my kid, that's all of those shots they get right away just to get it out. But
so hepatitis A, there's a vaccine against, and we do recommend that nowadays for everyone. Hepatitis A, hepatitis C, no vaccine for it. But hepatitis is just a virus that affects the liver. And depending on, so hepatitis B, some people are lucky and they get it, liver gets inflamed. have some symptoms related to that. Their body's able to get rid of it, and it's not a big deal. But for some people, it becomes a chronic thing. So you end up, the virus gets in there and it doesn't leave. And it ends up with long-term liver problems. And you can actually pass it on for pregnant moms, can pass it on to their kid when their kid's born.
No kidding. So it's transmissible. I mean,
yes. Yeah. Largely through blood to blood kind of thing. But hepatitis A, the reason we recommend that is that one's actually GI tract often. And so that's one that you'll see like, oh, this romaine lettuce is infected with hepatitis A, and so don't get that.
Okay.
Don't get that lettuce, or they routinely recommend it for travel because you'll see it more in like Mexico and things like that for hepatitis A. So they say, oh, get a hepatitis A vaccine before you go to these types of countries or things like that. But yeah.
So that's okay. So A's and B's we're good with.
Yeah.
C, D, and E are still working on those.
Yeah. Right. No vaccine. There's treatment for Hep C, but for Hep B, kind of same thing. The best thing is to get vaccinated.
All right.
Because once you get it, and if you have it long term, we can try to make it not as bad. We can try to suppress it, but it's very hard to get rid of. And so if you just are vaccinated prior to, it helps. And so it's one that's, I think nowadays, for childhood vaccines for schools, it's mandatory, but there is this population in the U.S. that have never had it, never had to have it. Sometimes I'll see them coming to get it because they're going to start working for a healthcare facility. Healthcare facilities often recommend, getting hepatitis B vaccine because they don't want someone accidentally getting poked with a needle while trying to draw someone's blood or give them, medication, and then getting Hep B transmitted from one person to another. So a lot of workforces are saying, "No, get your hepatitis B vaccines." It's a 3-part vaccine for most adults.
Okay, excellent. HPV is the next one on the list.
That's interesting.
This one, now is this, and you can obviously correct me when I'm terribly wrong. Is this this can cause cancer, can it? Mm-hmm. Is this the vaccine that people have claimed is like really one of our first true vaccines against cancer?
Yeah, I would say that.
That is amazing, honestly. Mm-hmm. And it's not just for women, right?
No. So everybody should get it. When it first came out, we were just strongly recommending it for kids because it was pre any kind of sexual activity, because it is largely transmitted through sexual activity. And so they say, okay, we get it to the kids who are 9, 10, 11, 12 before any of that even happens, and then they'll be resistant to these types of HPV, which is a virus, human papillomavirus. And with this one, there are hundreds. There's, HPV 1 to 100 and something or something like that. And so some of them are riskier than others. Some of them are more likely to cause issues. And so the vaccines are geared towards those ones that are particularly risky. And the types of cancer that we're trying to prevent largely was cervical cancer. But I've seen reports saying like, oh, HPV might be related to penile cancers. HPV might be related to throat cancer or pharyngeal cancer. HPV might be related to certain rectal cancers.
Wow.
And essentially, it's just a little virus gets into the body and just causes local, tissue irritation until that tissue starts to grow to try to protect itself, and then that grow gets out of control and becomes a cancer.
Right.
Essentially.
And again, these are adult vaccinations. We're talking HPV
HPV is okay. Like kids can start getting at age 9, but it's been approved up to age 46 now. And so
after age 46, is it HPV not as
No,
prevalent?
It's just they think maybe it's too little, too late. If you've been exposed to it, you're going to have been exposed to it. They don't know if it's as effective.
Okay.
But yeah, I mean, it's also you get into the realm of like insurance coverage on it.
Yeah.
And so I think most insurances will stop coverage at age like 26. Because again, it's that thought that like, okay, we're trying to vaccinate you from before you get exposed to this HPV, and if you do the vaccine afterwards, is it really going to be helpful? We don't know. There's actually thought that it still might be helpful.
Okay.
That like even if you've been exposed to these types of HPV, sometimes your body can clear it, and then you can get vaccinated so that it makes it even easier to clear it. Because that's what happens is as you get older, your body can't fight this virus as well.
Excellent. Okay, so HPV, another one highly recommended for adults.
Mm-hmm.
We'll move on to pneumococcal vaccines then.
Yeah.
So that's a word I'm surprised I pronounced. And can you explain a little bit about what that is?
Yeah. So your pneumococcal vaccines are against strep pneumoniae. And there's a couple different kinds, different, varieties of those pneumococcal bacteria. And depending on where you're at, what kind of vaccines your clinic keeps will depend on what they're going to recommend for you. But essentially, as people get older, you're going to be more prone to pneumonia. And the most common types of pneumonia is streptococcal pneumonia. And if we can, get your body kind of beefed up immunity-wise against it, you can hopefully not get it, because it is somewhat contagious. People can spread it between themselves, but also people will get it if you end up with like a respiratory virus and your immune system gets weak. Then you might get, streptococcal pneumonia. If you're immunocompromised for some other reason, you might get streptococcal pneumonia. People with bad lungs. So for most people, it's, in your 60s that you're going to be getting these pneumococcal vaccines. But for people who have asthma, for people who are smokers, for people who have COPD, you start getting that age down to like whenever you can get it into them. And so it used to be standard that there were 2 pneumococcal vaccines, PCV13 and PPV23. And again, this is just kind of like, this goes against these types of strains, right? And you'd get one, and then maybe a year later you'd get the other one. They do have something called PCV20 now that is considered kind of a one-and-done vaccine for most people. And so you can just get that one, and it should cover you well kind of going forward.
That's the best, when you can get it down to just one.
Yes, that is. Yeah, it helps.
Now, the next one is, oh boy, this is a hard vaccine to take, and maybe it just was for me. I had experienced it, a very small version of shingles one time, and I believe shingles is nerve-based, correct? And if you've ever had shingles, I don't recommend getting it ever. It's the itching that comes with shingles that can almost it's mind-numbing. In instances, I had it kind of come around the nerve kind of on the left side of my body a little bit, like right here.
Yep.
And so I'm like, all right, let's go get the vaccine. Went in to take it, and the nurse said, okay, here's your first one, because it's a 2 vaccine.
Yep. You do one, and then about 2 months later.
Yeah. Oh boy, that is a hard vaccine to take.
Yeah. What happened?
Well, it just wiped me out for about 48 hours the first time. 3 days the second time I took it, and they said this can happen with this vaccine. Why is it so? I'm so glad I did it.
Yeah,
but oh boy,
with all vaccines, what you're trying to do is get your body to create an immune response, so that a vaccine is something to tell your body, we want to create antibodies against this. We want to create a good defense against this. And so it'll expose your body to something, and then your body has to work on making a defense, an immune defense against that. And it's kind of the same thing as when you get influenza, when you get shingles. The reason that you feel cruddy often isn't necessarily because the disease or virus itself, it's your body's reaction to it. So that kind of, I feel wiped out for 2 days, I got muscle aches, sometimes even fevers. It's because your body is reacting to these things. Shingles isn't a common one that I've heard that. Usually it's always, it's influenza. People tend to, in COVID, with COVID vaccines, people tend to be like, maybe a day or two. For me with COVID, it was, the first 3 that I ended up getting, I went fine, but the 4th one, I ended up having a day where I was just real achy and didn't feel great. But all vaccines, your body's creating an immune response, and so you'll feel cruddy because your body's doing what it's supposed to do. It's kind of like, okay, this is expected, this is a good thing. We know that your body's fighting against whatever we just exposed it to.
Well, I will be, again, those few days I felt crappy were nothing to the days of having shingles.
Yeah, and shingles is a scary one. So shingles, it's a virus. It was a virus you were exposed to with chickenpox. And so if you ever had chickenpox, that virus never left your body. It went dormant into a nerve, and it just sits there and waits for you to be stressed, for you to be sick one day, and then it'll just flare up. Classic shingles is one side of the body, and it just follows that nerve. And so, it won't cross the midline. So if you see it from your back kind of going to your front, it'll just be on your left side or just on your right side. Sometimes people will have it on their face. The real dangerous one is when it gets into one of the nerves that involves the eye. That can get particularly dangerous. And so that's, the reason we recommend the vaccine for shingles, because for most people, it'll go away on its own, or there's an antiviral medication you can take to get it to go away. Maybe 2 weeks or so, you'll have some symptoms. But for some people, they end up with permanent nerve damage. So just imagine that itching, but just the rest of your life, and you can't. And itching, I would say, is probably the lucky, because most people, it's pain. It's like a burning, searing pain that they experience.
There was a little of that came with, but the itching was just.
And so to prevent the potential for long-term nerve damage, you get the vaccine. I think only 5% of people who get the vaccine will ever have shingles, and none of those people will end up with permanent nerve damage.
Oh, really? Well, I can't recommend it enough. No matter, and you'll probably get through it better than me, whatever. But it's maddening. All right, so the last ones we have on here are what a lot of people understand, the Tdap, I think. Is this? Can you get this as a kid too, or is this only an adult thing?
No, you start the series as a kid.
Okay.
Because of so Tdap is essentially only made as a Tdap, and so it has all three parts in it nowadays, and so that's what most clinics will carry. But it's tetanus, which is the one that we're worried about with adults. Diphtheria and pertussis are diseases that don't really affect adults so heavily when you do get them, and most people are vaccinated against them, so it doesn't happen a lot. But pertussis is like whooping cough.
Yeah.
And that can be scary for a 6-month-old to get whooping cough. And so vaccinating kids young. It's also one that it's a fun vaccine because we give pregnant moms this vaccine because the mom will get the vaccine, create the antibodies, pass those antibodies down to baby.
So cool.
When baby's born, then they'll be immune to whooping cough. And then, because they can't get their first vaccine until they're like 6 months old.
Right.
And so that's when they'll get their first. But yeah, it's, diphtheria, pertussis, not so interesting as an adult, but tetanus definitely is.
And tetanus is something that, we all have to worry about when we're around anything that's rusty. And that's, I think, what a lot of people associate tetanus with, right?
Which is a bit of an old wives' tale.
Here we go again. I love this. All right, let's bust it then. Where do you generally get tetanus from?
It lives in dirt. And so it lives in dirt and soil, and so it's dirty wounds that we're worried about. Rusty things tend to be dirty.
Sure.
And so they have that association. But you can get tetanus from dog bites. You can get tetanus from snake bites because they rut in the ground and live and get dirt in their mouth, and then they bite you and get the tetanus in there. So those are other things that we'll do for tetanus. But any dirty cut. So for a lot of people, if you're saying, oh, yeah, I had a clean knife, I was sharpening it and cut myself, probably don't have to worry about tetanus. But, oh, yeah, this is my buck knife I used for hunting and was gutting a deer and cut myself with it. Oh, for sure, we should be worried about tetanus because that's a dirty cut. Yeah.
And here's what's fascinating, and we're going to bring rabies into this now, too, okay? Tetanus and rabies are two instances of a virus that
tetanus is a bacteria.
Tetanus bacteria. Yep. There we go. That can be treated with a vaccine, but don't have treatments available.
Exactly.
Correct.
Yep. So that's the
I'm
big reason.
Fascinated by this.
Yeah. Tetanus is super rare to see, and I couldn't tell you if it's just because it has a hard time getting into people, or if it's because people are so well vaccinated nowadays. But you just don't see it very much, and people are vaccinated. But if forbid someone gets a dirty cut, isn't vaccinated against tetanus, doesn't get proper treatment afterwards, and it sets in, once it's set in, there's no way to cure it or get rid of it. You just hope that we can suppress everything enough so that your body can try to clear it. And it's rare that happens. A lot of people will die if they get tetanus because that's when you get lockjaw, tetany, body spasms, muscle contracture, things like that. And diaphragm will stop working. People will stop wanting to breathe. And so we have to try to paralyze them, intubate them, and hope that they can kind of ride it out, essentially putting them into a coma. Rabies, same thing. If we, the classic thing is most people aren't going to be vaccinated against rabies prior to getting exposure. Some people do, like veterinarians and animal control people, they recommend. But average person, never get vaccinated against rabies. Maybe in Minnesota, it was actually pretty classic of someone would wake up and there would be a bat in their room. And so the recommendation from the CDC is if you wake up and there's a bat in your room, go get rabies treatment because bats can bite you and you don't feel it. And sometimes it can be hard to find. And some cases of people who died from rabies, they say, don't remember getting bit by anything. And they think in those cases it was probably an exposure to a bat and they just didn't realize they had gotten bit by one. But you go in, and if there is a wound, so maybe a dog bit you that you didn't, Cujo bit you, and so there is like antigen that you inject around the wound itself, and you try to get that saturated with that to try to fight the bite itself, and then they give you a vaccine. It's like day 0, day 3, day 7, day 14. You get repeat shots of that vaccine, and then you're actually good and vaccinated against rabies. And after that, if you get exposed, you only need a booster.
Is it still it's not the shots in the stomach anymore? with rabies,
No.
is it?
No,
Okay.
no.
I remember that was a big deal and a big fear. When I was a kid, I remember everybody talked about that.
Yeah.
And if you got bit by that stray dog, it's like 700 shots right in the stomach. And that's how we're going to have to fix this thing.
They're intramuscular shots nowadays. They can be a little expensive. It's a super rare thing.
Right.
So, most people, you get bit by a dog, it's, Joe, the neighbor's dog, and you can ask Joe, hey, has this had its rabies vaccine? And even if it didn't, you can either test the dog or test the animal that bit you, or you can have it caught and then just observed for a few weeks, because if they bit you and they had rabies, they should show symptoms prior to you having any issues with it. And so it's like, okay, we watched it for a week. It's fine. You're not going to get rabies. You'll be okay.
How long do you have after being bitten by something with rabies?
At least 2 weeks. Usually, symptoms won't start up for about 2 weeks in people after rabies exposure, because that's how long it takes to incubate.
Symptoms start, you're in trouble.
You're gone. Yep.
Yeah.
Yep, and it's too late at that point. Yeah, and you get the classic, fear of water.
Right.
You're afraid of water because your throat muscles aren't really working. You salivate at the mouth because the virus wants to spread, and so it gets into the saliva and creates more and more saliva. People get bad headaches because it gets into the nervous system, and sensitive to light, and so they won't want to be in light, and so.
Well, last episode, you and I were talking about first aid, and I was afraid of ticks. Now I'm afraid of bats. You've turned that whole thing around. We don't worry too much about that around here, do we? I mean, is rabies? Is it a big deal for our area? I mean, I suppose it can happen anywhere, obviously.
It can happen anywhere, and a lot of state governments and health departments and things like that will keep track of which animals are likely to carry rabies and like what the incidents are. And by far and away, it's bats. And it'll be funny because you'll get people come in like, oh, I got bit by a squirrel, and I'll have to call up and be like, what's the likelihood that this squirrel has rabies? And they'll tell you like, there's never been a squirrel found with rabies in this state. You're fine. I'm like, okay, well, then we're good.
So if you're going to get bit by a small furry mammal, you want it to be a squirrel.
Something like that, yeah. But yeah, I've seen anything from reports on raccoons, skunks, things like that.
Okay. Well, this, again, it's been a lot of fun talking with you, Dr. Tronnes, about these adult vaccinations, which obviously you highly recommend.
Yep.
And, just go in and speak to your doctor and get those lists and find out.
Yeah, any primary care clinic is going to have a lot of those vaccines. The only odd one out is going to be shingles. Shingles, actually, you have to go to a pharmacy to get.
Right.
For insurance reasons, but they can talk to you about, the risks, the benefits. If you have any concerns, there's a huge vaccine registry online where anybody can go in and say, hey, I got this vaccine, I got this weird symptom, upload it, and doctors can go in there and say, here's what people have reported that have happened since they've been getting these vaccines. And so
where's that database, or what? Do you know where it is, or where it's?
Yeah, it's just the online vaccine registry.
Okay, so if you can search that,
like a VR or something.
Okay.
You can just go online and search it, and it's not the easiest thing to navigate because you have to go, okay, it was this vaccine, and like, out of this one, there's like 6 of those kind, and so it was this one, and then you pull it up, and they say, oh yeah, one person reported that they, forgot the rest of the day kind of thing after getting it. And so, there are side effects to it. The reason that these things get approved is because the benefits of not getting those diseases, not spreading those diseases, far outweigh the risks of any possible bad side effects. Because
that's so important for people to know.
Some of these things, I think like flu vaccine, there's like a 1 in 2 million chance that people will end up like with a nerve issue that'll cause some weakness. But when you look at how many people die from influenza, it's definitely higher. It's like 1 in like 100,000 people. And so, okay, we'll take the risk of 1 in 2 million bad thing happening to save a 1 in 100,000 people, not dying from this.
It makes perfect sense. It does. Dr. John Tronnes, family medicine physician, Monument Health up at Lead Deadwood. Thank you again for coming out and talking about this. I appreciate it.